do these tomorrow, you can talk through it and not actually do it, because if we actually do it, we're probably going to beat up a lot of times. Okay? So, yeah.
Isn't there something like, is that where your patient would get like a sigh or they'd breathe?
Yes, we're going to get there.
Or something.
So, we feel a flexion. I'm going to exaggerate for you. We feel a flexion. Can everybody see me if I just hold in the center? All right. And we want to resist that motion. So, we'll feel it push onto us, and we resist it. And then when we feel it move away, see what I mean, into extension, then we're going to encourage that. We're going to follow that. It's going to come and push on us, and we're going to resist that flexion. We're going to follow the extension. So you want to follow extension. So you're really kind of flattening out the back of the head instead of making it fuller in the back. That would be flexion. We want to extend it. Okay? So as we're driving it into extension, you'll feel where that force into flexion gets less and less and less. And you just keep following and following and following. And then what do you hit? When you don't feel anything, we call that a still point. So when it stops moving, that's a still point. And then you wait. And that still point may last 2 seconds. That still point may last 20 seconds. You wait till that still point changes, where you start to feel it come back into you. And as soon as you feel it come back into you, I usually wait like 2 or 3 cycles to make sure, oh, did I imagine that? No, I feel that. Yep, I feel that. And then I'll just slowly take my hands off. You don't want to just abruptly like, oh, it stopped, I'm done. You want to get to the still point, wait till it restarts, and then slowly take your hands off. All right, that might, yeah.
So CV4 is used to treat compression?
It can be used to treat compression.
So you're going to use compression to treat compression?
It can be used to treat compression, because usually when you get to a still point, when that bounds back out, it can jumpstart that a little bit more. All right. So another way that you can use to treat SBS compression would be, how else do we enhance better motion? I'm sorry. As you use the paper first. That typically won't restart a serious compression. Venous sinus drainage would be the other one. Okay? And I don't think they're going to ask it in that format, but I'm just trying to get it into your head about why we would do these instead of them just being these techniques. Okay? Other reasons to do venous sinus drainage? Headache. We want to decrease the inflammation or the tension inside the head. I told the story about my brother-in-law who had a nitro headache, and by doing CV4, I actually took that away, which is it's surprising. So it was good. So hopefully everybody gets that response. If I jump back to the CV4 for a second, some people use it at the beginning of a treatment to kind of calm everything down and kind of jumpstart the system. I tend to use it if patients are really agitated, like, you know, they just can't calm down, they can't stop talking, they can't like relax, and I'm like, okay, quiet, which I don't say very often, okay, quiet. And then we get to that point that I might use that to calm their system. More commonly, people tend to use it to kind of jumpstart their system. The venous sinus drainage, I will often use in the beginning because I feel like it helps open everything up. As you're releasing that tension in those venous sinuses, then it's kind of allowing better motion to flow throughout the cranium, so then I can pick up strain pattern easier. Less work for me. Okay? So that will help treat SBS compression. There's other techniques that we do where we literally get on the occiput and get on the sphenoid and try to just pull them apart. We haven't showed you that, but just to let you know. Okay. Are we good with the strains, or do you guys want to go back to this? We're okay with those? Okay. So CV4, you're taking it into extension, you're waiting for a still point, you're letting it restart, and then you're slowly taking your hands off. Again, that could be to open up the system more, it could be to calm down the system in general. It's to improve overall motion. Venous sinus drainage, I need a skull. Jack, can you get a skull out of the cabinet, the third drawer down?